Hello, hello. I am Dr. Heather with the Junk You Should Know Show. Welcome. I had a few technical difficulties. I apologize for my tardiness. I went to go live and it wouldn't let me. So I had to kind of log the show in all over again. So I'm glad I made it on. If you join, please let me know where you're from and whether you prefer to use heat or ice when you are treating an injury or anything like that, because that's what we're going to be talking about is when to use heat, when to use ice therapeutically for injuries, and it's not as simple as you may think. But before we begin, I'm going to talk about a couple of things. One is the funniest experience this last weekend, and I'm telling you this for no other reason than I love situations that make me look like a goofball. And so I had my goddaughters down, and it reminded me of Junk You Should Know. That's why this story is being told. So my goddaughters were down, we're driving in the golf cart over to somewhere, and we were passing the main pool, and I said, oh guys, there's the pool. They're 16. There's the pool, and you could go there anytime if you want to. It's really cool. It's big and great. And one of the girls says, are there snacks there? And I said, well, yeah, I mean, you can order from the restaurant, and yeah, I'm pretty sure they deliver out to the pool. And they both start laughing because apparently, hi, Cynthia, apparently snacks is lingo for cute boys. It means nothing to do with food. So the 48-year-old godmother put her foot in it because apparently I don't know all the lingo. And so that was very funny. So that's Junk You Should Know, is that are there snacks doesn't mean food. It means, is there going to be a cute person there, or are they cute? So keep that in mind. You can use that going forward. You don't even have to give me credit. Hello, whoever just checked in. Please say a big hello. Let me know where you're logging in from and whether you prefer heat or ice, because that's what we're talking about, is heat or ice today. I also want to remind you that check the links below after the show, because in the comments, there's going to be all links to different products and stuff that we talk about today, as well as a link to the Change Cave. And remember that Change Cave bonus week is next week. And that means expert wellness presenter videos, online interactive journal, onboarding class, and a forever price fix of the $23.99 a month beta price, which is going away on Saturday. So if you've been thinking about the Change Cave at all, next week is the time to do it, between the 10th and the 15th. And if you don't know what the Change Cave is, there is a link going in the comments below that will tell you all about it. I won't eat up our time talking about that today because we have a lot to get through. How often do you have a spouse or a little one who presents to you with an injury and you think, oh, I don't really know what to do here. Should I put heat on it? Should I put ice on it? Should I throw a bag of peas on it? Should I put a heating pad on it? Hi, Christine. Great to see you. Should I put a heating pad on it? What should I do? Often we're just we're not really too sure, are we? And that's what we're going to talk about today, because at the end of today, I want you to be decisive in your actions of applying heat or ice with the foundational knowledge that you are doing it correctly. Okay, so again, our topic today is heat or ice. You're probably doing it wrong, but we're going to fix that. Ice is where we're starting. Excellent in an adult beverage. Also extremely therapeutic. You often see athletic trainers running out on a field with an ice pack. Any second that an athlete gets injured, it's kind of the equivalent of Windex from my Big Fat Greek Wedding. We put it on everything because we think it's going to help, but do we really understand the reasoning behind why we're using ice? And that's what we're going to talk about today. So the first thing that we need to know is that ice is, pay attention, a muscle relaxer, a pain reliever, and a vasoconstrictor. Those three things are going to be really important when we talk about heat. Let's recap: muscle relaxer, pain reliever, vasoconstrictor. So there are some ways to use ice, and that is a gel pack. You guys have probably all seen those blue gel packs. You can get them on Amazon. I'm going to put a link below to my favorite gel packs. You can do an ice dunk or bath where you stick the injured limb or body part into a mixture of ice and water. You can use ice massage, where you take a block of ice and you rub it on the skin. And those are all different ways that you can ice, but they all have very different requirements. So just listen up. With an ice pack, 20 to 30 minutes maximum. You want to make sure the tissue rewarms back to room temperature before you apply it again. And that is true for any icing protocol. But if you are using direct ice or an ice bath, you want to only use for 10 minutes, again, allowing the tissue to completely rewarm to room temperature before you apply again. Why? Because you may subject yourself to frostbite. If you don't allow the tissues to fully rewarm, then about 1/4 of an inch down, it's still cold, and you apply an ice pack on top of that, you can drop the temperature so much that you actually damage the tissues. So please don't do that. Allow at least 30 minutes between icing sessions, and that can be super helpful. So gel ice pack. You can also make poor man's version of an ice pack by mixing 2/3 ice, 1/3 alcohol. Vodka works extremely well, and that makes a really nice ice pack. Another way to make an ice pack is take a dish towel, soak it in water, wring it out, and throw it in a Ziploc bag, throw them in the freezer. There you go. Because if you actually have an injury, don't use one ice pack, people, because it's not going to get cold enough between icing sessions. You need to be able to rotate your ice packs. So the blue gel ice packs, either ice and alcohol in Ziplocs, or wet dish towels in a Ziploc also works. That's my least favorite because it doesn't get cold enough. You know what else doesn't get cold enough? Frozen vegetables. Don't use them for ice packs, please. You will not get the therapeutic benefit you think you are from icing. And so those are your methods of icing. I did say, please let the tissues rewarm. That's my biggest warning, because the only downside of ice is that frostbite option, or the possibility of frostbiting your tissues. So please be careful with that. Now, with a blue gel ice pack or with your bag of ice, please don't wrap a towel around it, because when you put it on the skin, it's not going to get cold enough. It's not going to get numb. It's not going to have its anti-inflammatory properties. And so instead, you want to use a paper towel or 2 paper towels, but no more than that. If you're using direct ice, of course, you're not putting no barrier there. And that's why you can't do as long with the direct ice treatments, such as an ice bath or an ice massage. So with an ice pack or any equivalent, you want 1 or 2 paper towels between. You want to keep your ice packs in the freezer, not the fridge. The fridge is not going to allow that ice to get cold enough. And people, if you're going to endure the discomfort of throwing an ice pack on you, you want it to be useful therapeutically. And if you use too many towels or the ice pack isn't cold enough, it is simply going to just cool the skin and maybe provide some temporary pain relief, but not actually work. Jenny Butler from Ecuador is in the house. Fantastic. So we talked about barrier between how to use ice. We talked about the types of icing you can do. And we talked about that ice is a muscle relaxer, a pain reliever, and a vasoconstrictor. This is where things get interesting. What is heat? Heat is, when applied therapeutically, a muscle relaxer, a pain reliever, sounds similar, and a vasodilator. Okay, so there's a difference between those two. Ice is a muscle relaxer, pain reliever. Vasoconstrictor means it closes down those vessels. Heat is a muscle relaxer, pain reliever. Vasodilator opens up those vessels. That is going to become very important. But let's talk about the types of heat that you can use. Heating pad is an option that I'm going to tell you not to use. It is an option, but do we really want to put electromagnetic force right on our body with heat so that it even amplifies the whole thing? There's so much coming out now of us wanting to decrease EMF exposure with power lines and all sorts of, stuff like that. So why put it right on your body, right? So heating pad, electric blanket, not the best choice. Better, hot water bottle, old school. Just get yourself one of those $3 hot water bottles from the drugstore, and that is a perfect way to apply heat. And of course, you can do a hot bath. Epsom salt bath works great as a heat source for therapy. Heat, you want to keep to about 20 to 30 minutes as well. I have many elderly patients who have come to me with low back pain, and when we dig through the weeds, we find out what are they doing? They're sleeping with a heating pad on their back all night because their back hurts when they go to bed, and so they're like, well, I want to keep it loose, when in actual fact what's happening is they're applying heat for too long, causing too much vasodilation, causing inflammation to draw into the area, and then they wake up with back pain. It's a vicious cycle. So heat is similar to ice. You don't want to heat for super long periods of time when you're doing it therapeutically. Okay, so a bath or the hot water bottle, stick to that 20 to 30 minute mark. Remember that you are vasodilating when you heat. I'm going to give you a story that will illustrate why you need to be cautious of this. So let's take, what's his name? Joe. I called him Joe. Let's take Joe. Joe is a bit of a weekend warrior. He goes on a ski trip with a bunch of buddies and goes out the first day, knows they're going to ski hard, and they do. And he gets back and he's already got some back pain. So what does Joe choose to do? He chooses to drink a couple of beers because it takes the edge off the pain, and then jump in the hot tub, which is seemingly like a really reasonable decision to make. Only he stays in there a little longer because 2 beers leads to 3. And then he goes to bed and he wakes up in the morning in such severe pain, he can't only not ski, but has to go home. What has Joe done? Joe's made a grave, grave mistake. If Joe had gotten home from skiing and put an ice pack on his low back and drank some ginger tea, he would have had all sorts of anti-inflammatory benefits, vasoconstrictive instead of dilative benefit, and the inflammation wouldn't have had a chance to go willy-nilly, take off, and create all sorts of pain in his low back. So when applying heat, there is risk. The only risk with ice is if you overdo it, you're going to frostbite yourself. With heat, you can actually create more inflammation in the area, and that can cause problems. And that's one of the main reasons I always reach for ice first, because I know it's safer and I find it to be more effective eventually. And you can still do heat a little later in the treatment of the injury. My favorite is contrast therapy that we're going to talk about here shortly. But ice, in my opinion, is the safer way to go. And heat should be used discriminately. So again, hot water bottle, Epsom salt bath, 20 to 30 minutes, and not on the immediate onset of an injury. When an injury is brand new, we want to stay away from heat. A week or 2 into it, you can start playing with it. But again, in my opinion, ice is good anytime. Now, an ER doctor is going to tell you ice is good for 3 days, 72 hours, and then it's not useful anymore. I'm going to beg to differ. And acupuncturists are going to tell you ice, no, heat only. So there are going to be a few different opinions, but after 23 years of clinical practice and a lot of study on the subject, I'll go toe-to-toe with anyone who wants to argue with me about the physiological benefits of ice after 72 hours. I would be happy to do that. Christine, wow, that'll help my hubby so much with back pain. Sadly, he's like Joe minus the beer. Yes, too much heat it's going to feel good, and that's the confusing part, is it feels good when it's on, but it's actually drawing more inflammation to the area, or can be. Now, James Chestnut, who I have the biggest brain crush on, was my instructor for my special certification in Certified Chiropractic Wellness Practitioner program. And he stood up on stage and said, people, stop icing. We have an inflammatory response that is naturally built into our bodies. Let it take its course. And shout out to James. I love everything he says except that. And here's why. That is true. We do have just a bang up inflammatory response by our bodies. We send fluid to an area to give it cushion and to protect it from getting injured further. It has all sorts of healing factors. It has tissue repair factors. It has a cleanup crew. It's awesome. Like, our inflammatory response is a miracle. I'm not kidding you. However, the problem is that most of us are walking around in pro-inflammatory soup. And what I mean by that is that we have a crappy diet. We're exposed to all sorts of terrible toxins. We have stress levels through the roof. We don't sleep. And that puts us in a pro-inflammatory state where we're kind of walking around inflamed all the time. So then you go and injure an area, and now your body's like, whoa, and it way over responds, and we get way too much inflammation in an area. So until we're all living off the land with no stress and sleeping like babies and playing all day long and not dealing with all of those environmental toxins, I am going to recommend ice for my clients who have an injury that can be treated by ice. And the beauty of ice is it's a local anti-inflammatory when used correctly. So instead of ingesting ibuprofen, which is going to tear up your stomach and create all sorts of issues, if you stick with ice and you use it as an anti-inflammatory, which means you repeat multiple times, multiple applications for it to be anti-inflammatory, then you can get away without having to take the nasty chemicals, right? More stress on your body. So for ice to be anti-inflammatory, let me just go back to that. We want to make sure that you are, let's say it's a fresh injury. You want to ice every couple hours, 4 or 5 times a day. And if you do that for a couple days, in studies, it has been shown to be equivalent to ibuprofen. And so why wouldn't you want to just ice locally instead of anti-inflammatory your whole body where it can't discriminate against one thing or the other? So be cognizant of that. Don't necessarily just reach for the ibuprofen. Start with an ice pack and then go from there, okay? So we talked ice, we talked heat, we talked about Joe, who made a grave decision and chose to heat instead of ice. We talked about my buddy, James Chestnut, Dr. James Chestnut, biggest brain in chiropractic, who talked about we have a great inflammatory response. And yes, we do. We have an incredible, naturally responsive healing system that's innate and powerful and incredible. But again, when we get injured, we still want to use the ice because we tend to overinflame because we're walking around as inflammatory soup, if that makes sense. Okay, one last thing, contrast therapy. Contrast therapy is one of the greatest healing tricks of the trade. If you have an acute ankle sprain and you have iced repeatedly 4 to 5 times a day for the first couple days, 3 days, 4 days, even up to a week, you are eligible to start doing some contrast therapy, which can be an incredible, powerful healing tool. Here's how we do contrast therapy. It's a combination of heat and ice, starting with heat, 20 minutes, ice 20 minutes, heat 20 minutes, ice 20 minutes, the method of your choice. So you could do a hot water bottle and then an ice pack, a hot water bottle, then an ice pack. You could do infrared sauna, then a cold plunge, or infrared sauna, then a cold plunge. You could do just a warm, I forgot to tell you something, a warm hot towel, and then an ice dunk into a bucket with your ankle. So there's lots of different ways you can do the contrast. 20 on, 20 off is just a good rule of thumb, but you can vary that a little bit. And always end with ice. Why? Because it's vasoconstrictive. And we've just created a pump that opens up the system, closes the system, opens the system, closes the system to push out inflammation. And so we want to end on a close. We want to end on vasoconstriction. That's why we end with ice. Now, one little trick for heat that I forgot to mention is that damp heat is much more penetrating than dry heat. And so how do we do that? Well, in my office, we used to have this awesome hot water tank with these gel packs, and you'd wrap this thick terry cloth thing around it, and all the steam would come through, and it would push the heat in much deeper than just dry heat. Well, you don't have that at home, but trick is take your $3 hot water bottle from the drugstore, take a damp dish towel, wrap it around, and place that on your skin instead of just through a dry towel, because it will push that heat in a little more thoroughly and more therapeutically. Isn't that fun? So we talked about ice, we talked about heat. First line of defense, start with ice. If you suspect inflammation at all, stick with ice. If the inflammation has died down, you can try heat, but pay attention to how you feel 2 to 4 hours after or the next morning, because if you're flaring, that could be a result of, even though the heat felt nice, it may have drawn more inflammation to the area. Lastly, contrast. So heat, ice combination, ending with ice. Okay, did we forget anything? Remember that ice is a muscle relaxer, a pain reliever, and a vasoconstrictor. Heat is a muscle relaxer, pain reliever, and vasoconstrictor. dilator. So we want to pay attention to that when we're making our decisions. Okay, guys, got any questions for me? And if you are watching this in replay, do feel free to drop your comments or questions below because I will be checking back. I can't tell you how many people ask me this question of I don't know when to ice or heat. So I hope this has been helpful. And last week's essential oil Junk You Should Know show went a little crazy. So if you are interested at all in essential oils, please go back and check that. And keep in mind that you can watch any of the Junk You Should Know shows on the Well Fit and Fed YouTube channel. They're all there. So instead of trying to scroll through and search them on Facebook, you can just go to YouTube and they're super easy to find. So if you're looking for the old one from Dr. Bruce on your chronotype, or you're looking for Heidi's on sitting and the choices you can make to correct all the damage that's caused by sitting, or Dr. Laura's great show on the tools that rule in the kitchen, they're all there. So check them out. Okay, guys, I'm going to sign off. We talked about heat or ice today, and we also mentioned that the Change Cave has its bonus week next week, so make sure to check that out. And come back, check out the comments. There's going to be lots of dialogue on this, I'm sure, and I can't wait to engage. So thanks, guys. Same time, same place next Friday, noon. I'll be live again. I will be on my way to my 30-year high school reunion, so we'll probably be talking about that. All right, guys, have a great weekend. Love to you all. And remember to share and pass around this information so that everybody can benefit from it. Okay. Thanks so much, guys.